Well, for Richard, we didn't start the fire. That's a song lyric that you have there hidden in the, any reason why?
No, not particularly, but it's probably quite relevant to all other things we did early on, I suppose. When we started out with the sort of the slide you would have seen right at the top, which is the thing called stethoscope, which, as I say, NHS England now have a system called Model Hospital, which uses SBC and all those sorts of things to do all those sorts of things. We started it as a product, as a lot of people in the room are kind of keen to do, but you can't compete with free. So when NHS England decided to do that, we found that quite hard to cope with in some sense. So yes, we didn't start the fire, but we were there where a few other things happened. So yeah, but yeah, no, good spot.
Hey, I work for Nuon. We're a full-service digital studio specialising in medtech and health tech. The question to the lady on the left-hand side, sorry. Hi. Operating with the NHS as a service provider, we found extremely difficult. I mean, we've had one recent successful project with NHS. But how did, I mean, you mentioned that COVID was one of the things that actually sort of propelled you in, but for a business that's looking to work with the NHS this side of COVID, have you got any advice and guidance?
Yes, so I think that navigating the NHS is a nightmare. It's very difficult, that we must accept. But I think you have to be intentional in terms of where to find the people and get to speak to the right people. So for me, I've joined the NHS lab. Have you joined the NHS lab? Because inside the NHS lab, is where they have the conversations happening, and you can know who is who. So I can connect you to the NHS lab, and then also following the tenders and the frameworks that have been advertised for us. That has been the best way to go in. So we were part of the DFVOCV framework. We had to follow that. So follow the tenders that are coming out and make sure you have to go and apply for those.
Yeah, I mean, we found with the tenders is that putting a successful tender in is just literally one of the challenges. Yeah. You still then got to successfully network within your organisation. Just because you're on tender doesn't mean you're going to get the business. So yeah, away from the tender is really, what else is there we can do? And if it's just networking with the right people, then, we can do that. But are there any other tricks of the trade that you've picked up?
And then collaborating, for example, with organisations that are already in, like ourselves. If you have got something that can complement what we are doing, we could do a project together or something, but NHS is...
Oh, we've definitely got some people, I'm sure.
I can probably comment on that as well. So we try to work a lot with the NHS. Obviously, we've done some of that through the AHSN, but another really useful guide, especially if it's secondary care, NHS innovation leads. So most hospitals will have somebody who's in charge of innovation, and they are another route in that we found useful. But it is generally finding the person who's got the problem that you're solving, and who wants to try and do something different. Because you do get this thing about, it's another app, it's another this, it's another that. I mean, the advantage we have is that ours is free. So that's definitely another thing to consider if that financially would work with your business model.
Yeah, just to say, so our journey is, we launched in May last year. We've been networking, we've been talking to a lot of innovators, people who are bringing product to market, and that challenge is consistent. I think things like this are amazing in terms of building that life science powerhouse that everyone talks about that we can be. That's great, but the vast majority of people that I've talked to who are bringing medical or pharmaceutical innovation that could be life-changing and fundamentally change the funding that we need to support an ageing population are going to America because the market, and so we're building amazing things. Our ability to innovate and create magnificent things is fantastic, but the pathway to the money is so much easier in other countries that we're losing all of that opportunity for us to have healthier families, because any capacity that those successful businesses create is moving out into the world where it's easier to be bought.
Yeah, I mean, one of the things we found is the technology is there, the algorithms, the tech itself. As a UX design, specialist, is that we find it's the experience. It's either the interface or the experience where the challenge often lays. So one of the solutions we often try and provide is that if we can improve your user experience with using a 5 or a 10-day design sprint, that we found that industry and not-for-profit businesses really appreciate that. All of a sudden you're getting real-time analytics from users rather than just this tech that's going out on the platform.
That's it, yeah.
I just said, sorry.
I was just going to say, you're at the right, the timing's right. About 5 to 8 years ago, you would have died on your feet because in terms of user-centred design, the NHS was nowhere. Central government, other parts of government are much more up on it, but your buyers really for that are going to be people like your directors of IT and stuff like that, surprisingly, because they have big teams of technical people and no design function. There is not a single trust in the country that has a large, well-developed design function. Oh, that's not true. More fields, actually.
Okay.
But yeah, unless they do their own in-house stuff, it should be a right market, but finding your buyers is always the tricky part.
It's the big
part.
Yeah, two other thoughts, which I don't know if they're helpful or not, but they go back to some of the questions in the earlier session. So our CTO, he spent the last 4 or 5 years in pharma, but before that actually he's worked in many different sectors, so aviation, Rolls-Royce, nuclear, etc. And one of the things he finds really frustrating is whenever you have a conversation about health tech or any sort of technology or AI or anything like that in healthcare, that people are standing there and go, oh my God, but this is patients' lives, we can't take risks with them. And he goes, when a Boeing 747 is autopilot 99% of the time, you don't really have, your error of margin in aerospace or in nuclear is pretty small too. But compared to those industries, pharma, so my former life was also the last one was in a technology company in pharma. We're complete dinosaurs. We really are. But we very much hide behind this patient safety thing. Yeah. But that's not helpful. That's just another moment. Sorry.
But we're with you, brother. We're with you. All the way.
Super. Are there any other questions?
Yeah, this is really an observation on the three of you, Fungai, Debra, Adam, is it? Yeah. It's astonishing, really, if you look top down on what you guys have been doing, is the potential of the disconnect between what is happening in, let's just call it industry, and what is happening at government, and the inability of government to connect with these ideas, because seriously, all of your technologies should be part of our national infrastructure. Mm-hmm. I mean, Debra, yours particularly.
Yeah,
well,
we have
about resilience.
We are having those conversations, but they're very sensitive about it being their area. And we're a commercial organisation, of course, and people. And I'm a scientist, so I'm always very wary of business development people and people who are trying to sell me things. But the experience is very different elsewhere. So we've got, we're tiny at the moment. We're planning to test in the UK this quarter, but we've had the largest hospital in Switzerland contact us. We've had one of the biggest teaching hospitals in Boston contact us, proactively reaching out to us. So it does seem very unique, the NHS and the way that it approaches.
Can I just jump on that one? Yeah. I have never been phoned by an NHS chief executive to ask for a piece of analysis on anything. I like 3 removes perhaps, but honestly, that is one of the things that is a problem.
I think a couple of points. One is the vast array of negative authority that exists in the people we're trying to engage with, who may be fearful of something that's different. So 95% of people can say no. Another 4.7 can say maybe not. And getting to the people that can say yes is really hard. I just want to give an example of the policy bit. I had a bit of a Twitter rant on Monday. But having watched Richmond awarded some of the levelling up money because their bid was amazing, I'm looking at some of the information that we're working with that costs millions of pounds to curate, collate, bring together and publish into the public domain, like where's the deprivation, where's the long-term conditions, fully enough there's some strong correlation. There's a set of numbers that could create an algorithm that could distribute £350 million equitably to the point of need. You could even theme it, crime, long-term condition management. They didn't even use that to baseline the bids. To go, that's a really good bit, and I love it, it's very glossy, love the architect, that building's going to look amazing in that market square. Is it going to deliver something for the population that our algorithm says are the right people to mobilise millions of people who are underserved or underprivileged, that could, with the right distribution of what we have at our disposal, achieve some of the things that they have in their life that they want to achieve? Absolutely. it's an absolute nonsense. You're quite right, and we're doing what we can to fix it. I don't know what that'll be, but we'll die trying.
I could just make one comment on, I think the government piece in the NHS, I think it's challenging in itself. I think as well, background in pharmaceuticals, and one of the things I would say from working with a lot of different companies, there's companies that are developing lots of innovations and they're really innovative, but they sort of, if you go through the TRL levels, their technology readiness levels, they're developing them and they get really good products and it's there ready to launch. But then there's a whole piece, it's like, how do you get the adoption, how do you do that? So within pharmaceuticals, it's called market access, and actually there's a whole piece behind the scenes that the general public doesn't see, and it's like sort of engaging with key opinion leaders, doing advisory boards, doing all of this, assessing the market opportunity, pricing, all of this. And actually, some of the innovations that come along, it's all good to say, it's like, I've got this great innovation, well actually there might be another 50 companies that are doing the same, and it's needing to define the right value proposition and everything else like that, as you would do if you're doing.
I think there's another one as well. There's huge amounts of effort, time, money being invested in innovations that are miraculous and incredible for a very small demographic. So that bit of all that effort, and someone goes, I bought this to market, and it's like, that's great for the 8 people that can use it. Whereas something that's only half as good, that would benefit 10 million people, doesn't get the bandwidth. So, and I think that bit of, we need to reverse the data into the innovation space and say, build me this.
But if you consider the example you just talked about there is a body, NICE, which for better for worse accredits whether or not people are allowed to purchase those drugs, for instance. And the moment they say yes, every hospital in the country can then go and purchase those drugs. Whereas if you're going to procure a new hospital IT system, guess what you're doing? You're on your own, start from scratch. You can talk to the people you know in the industry, you can talk to who else, but you have to do it all on your own. So we expect every hospital in the country, every GP's practice, which a GP practice 10 years ago was what, 3 people? And they apparently have to be experts in procurement. What chance have you got? You know, we don't have a chance of reaching all of these people, and they don't have a chance of reaching all of us. So that is the fundamental problem. I think, you know, organising sort of situations like this, some of the groups involved today who bring those innovations up to those people, there's a next step to take, which is providers that you've worked with before, and I know it already happens. These guys are good, work with them. This is a really good thing, and we know it works. We know they work in the right way. But it's all softly, and at some point we're going to have to get a bit bigger than that, a bit more ambitious, a bit more integrated than that, I think, across the country for it to work.
I was going to say, though, my experience, just to add what he was saying, was when I reflect on my experience trying to walk this journey with NHS, I think you also have to be in a place where you have got funding to fund all this work that you're doing, which people don't see in the background, because there is a lot of barriers to entry. ISO 20,000, ISO 9,000, ISO 27,000, all these things, they cost thousands and thousands of pounds. So I think I was going to add that as well, that I have been doing a lot of applications to work with the NHS, for example, the NHS Entrepreneur Program, which I was told I can't do it because I'm not an NHS employee. I have been trying everything to figure my way, but you find that everything is protected for the NHS. And then you have to figure your way around. And basically, I am super aggressive. I will figure my way around it, and I'll go for it. Because at the end of the day, these solutions need to solve our problem, and we are the people in the UK. So that's kind of my approach, honestly.
There's that assumption, isn't there, that if you're a commercial body, then what you really want to do is take the public's money and squirrel it away and sit on a big pile of gold like Scrooge McDuck, as opposed to having any kind of ambitions to use it for the public good.
Exactly.
I think it's the crazy thing is that a huge number of people who have joined our organisation ever since we were founded are excited by the idea of doing public good with the sort of data and stuff we use. That's quite a common experience. The NHS is kind of one of those few things I think most people in the country agree about being a wonderful thing, and everyone's upset it's a bit broken. So why is it that we go and talk to someone and they're just like, well, that does seem a bit expensive, and like, well, we're not trying to rip you off.
And actually the profitability and that working for money thing, we are frowned upon at times, but there's 6,500 organisations that are privately owned and profit making that are looking after us every day, and the irony of that irks me a tad.
Okay, I'm going to take no more questions because we are running a little bit late, but I would ask just the panel if there's any sort of take-homes from today or advice. Fungai, have you got any?
I really think that if we could have more of these where we can come together and we can start creating stronger networks where we can become a bigger voice, I think that would think that's what's being echoed in the room. So thank you guys for putting this together.
Debra?
Yeah. Slightly related, but just a general comment that I often give to people who I mentor and when I go to universities and things is just generally in life the way ahead is to network, and therefore events like this are really useful. But always be connecting to people. You never know when you could be useful to them or when they could be useful to you, and that's how we'll solve many problems.
Just to echo that, you know, this is fantastic. It's always great to talk about what we do, but to listen to other people that walk in that journey, you know, just feeling like I'm amongst my tribe, feels good. And thanks to Medilink for that, and you know, and the other things you've supported us with.
If you think something's stupid and wrong, challenge it. It doesn't matter whether, you know, it's difficult to challenge or anything else like that. Particularly if you work within the health service, it's really important that you continue to do that. It's so easy to get kind of worn down by how hard it is to change things, but fundamentally the change has got to come from somewhere. So, you know, if you do work in it, please continue to fight, because, you know, there are people out there also trying to help.
Yeah.
Okay. Can I have just have a few hands for the panel today?